Hi, I'm Dr. Chan here at Crown Dentistry. We've been getting a lot of questions about teeth whitening, so today we're going to answer some of those questions and hopefully give you a better understanding of what teeth whitening is and what some of the procedures are that can whiten your teeth. So, teeth whitening is a very broad statement. It encompasses a couple of different topics. Obviously, the basic premise of all of these different kinds of procedures and substances are things that are done to make your teeth brighter or whiter. There's a couple of different ways that this is done. The fastest and easiest way is through certain kinds of toothpaste. I'm sure you've seen that on the market, either through Crest or Colgate or Discus Dental. They'll advertise their toothpaste as a whitening toothpaste. The way that usually works is these toothpastes are just slightly more abrasive, which means that they're better at getting stained or dark substances off of your teeth. To get something that's a little bit more long-lasting, though, you're going to need something that has a little bit more to it than just an abrasive paste. Now, a lot of these teeth whitening substances, they market them as gels or pastes, and a lot of these teeth whitening substances will have either hydrogen peroxide or carbamide peroxide, some sort of substance that has basically these chemicals that will help to make your teeth whiter. So teeth whitening, if it's done properly, will not damage your teeth. That being said, it has to be done properly, and the best teeth whitening substances are done under the supervision of a dentist. I know there is a number of over-the-counter procedures and products that you can buy either at the store or online. These will work and they will whiten your teeth. However, it's important to remember that there are some side effects that can occur by using teeth whitening products, and you just need to be aware of it. So as we mentioned earlier, there's two main ways that we whiten teeth. One is by the use of just whitening toothpaste. We do have whitening pastes here in the office that you can get. There's also a number of tooth whitening toothpaste that you can get over the counter in the stores or online. Like I said, those mostly work by just polishing off either stains or substances on your teeth that might otherwise darken them and make them not as bright. Those are great. They're relatively harmless. They also don't tend to last as long. Also, they don't work quite as well if you tend to eat or drink dark colored foods such as berries, wine, cola. So all of these things can contribute to tooth darkening. And then you would, of course, use tooth whitening products to counteract the effects of this. Another product that we also use to whiten teeth basically contains usually either hydrogen peroxide or carbamide peroxide. These substances go one step further in terms of trying to whiten your teeth. They'll actually essentially pull the stains out of your teeth, thereby making them brighter and whiter. One of the big new products that's out on the market now are LED teeth whitening systems. A lot of these you can get over the counter, or sometimes you'll see them in the malls. They'll just put a light on your teeth and basically claim to brighten your teeth. We actually do have a similar setup here in the office. The main thing to remember is that LED lights alone will not whiten your teeth. You need some sort of a chemical substance that's applied to the teeth in order to actually remove the stain or pull the stain out of your teeth. So LED lights just usually serve to accelerate the process. But like I said, the lights alone will not whiten your teeth. So one of the things to remember when you do whiten your teeth, whether it's in our office or at home, is that there are side effects. One of the biggest side effects is increased sensitivity that you may experience, either to biting, to hot, to cold, sometimes sweets as well. A lot of times that happens because when the tooth whitening chemicals are applied to your teeth, they'll remove the stains from your teeth, which is obviously a good thing. What will also happen though is sometimes they'll open essentially pores in your teeth that can then make teeth a little bit more sensitive otherwise to temperature and or biting. Another thing that needs to be remembered is that you need to be careful if you're using some kind of tooth whitening product and there's either a gel or a liquid that you put on your teeth in order to whiten them. You have to make sure that you don't put so much that it spills over the teeth and onto your gums, because the substance can sometimes be a little bit caustic, and if they're applied to your gums for an extended period of time. So if they do contact your gums for a longer period of time, it can sometimes leave a slight burn on the gums. It's not irreversible. Eventually the gums will heal, but sometimes that is a side effect that we do notice when people whiten their teeth. Sometimes people ask if we can whiten teeth permanently, like you don't have to do the whitening procedures on a regular basis. Unfortunately, there's no way to whiten them permanently unless we actually place restorations such as crowns or veneers, basically something to either cover up or hide the tooth underneath them. That would really be the only way to whiten teeth. That, of course, can be done, but if you want to simply keep your teeth as they are, we basically need to do the whitening procedures on a regular basis. A lot of times our patients will get their teeth whitened once a year, once every other year, and they find that that generally tends to work pretty well. So we had mentioned earlier, some of the main side effects from teeth whitening are increased sensitivity on the teeth, mostly to temperature, hot and cold, because like we were saying earlier, if the teeth whitening products are placed on your teeth, they basically pull the stains out of your teeth, and that's how your teeth get whiter. But in doing so, what that usually does is that opens up the pores in the teeth, which makes them a little bit more susceptible to hot and cold, either food or drink. So it's not a permanent effect. Usually that lasts for maybe 2 to 3 days after the tooth whitening procedure. After that, usually the pores will close up again and the sensitivity will decrease. Usually what we do while the patients are having their pores opened in their teeth, and just right after the whitening procedures, we'll just tell them to rinse with warm salt water, and also just to take a little bit of ibuprofen, anywhere from 400 to 800 milligrams every 6 to 8 hours, just to relieve the sensitivity. Another potential side effect that can happen is if too much of the tooth whitening product is used, it can spill over onto your gums and create a small surface burn. Again, not permanent. It will usually take anywhere from 4 to 6 days after the tooth whitening procedure, if this does happen, and eventually it'll heal. Sometimes we will recommend that people rub a little bit of vitamin E oil on their gums, and usually that will help to soothe the burned area. So we mentioned earlier, sometimes people need to do tooth whitening procedures on their teeth on a semi-regular basis in order to maintain the visual effect that they want. Unfortunately, the effects of the teeth whitening procedures don't last forever. So usually people do them either once a year, once every other year. A lot of times they'll just, for example, when we do tooth whitening procedures in our office, we'll make trays for our patients. And if you want to sort of touch up your teeth at a later date, you can just get additional tubes of teeth whitening gel and use the trays that we make at the initial appointment. You can just fill the trays with the gel and then place them on your teeth for 20 to 30 minutes a day for a week at a time. Usually that will give most people the effect that they're looking for in terms of whitening their teeth again. Another thing that's really important to remember is just to maintain good oral hygiene, just being good about brushing, good about flossing, making sure you remove all the plaque and calculus off of your teeth so that they look as bright and white as possible. The last thing, and possibly the most important thing to remember, is that your diet definitely affects how white your teeth are. Some of the most common causes of staining and just making your teeth not as white are red wine, berries of any kind, darker sodas such as cola or root beer. Not to say that you can never drink any of these things. Oh, also, tea and coffee, of course, are some of the most common culprits that people are generally seeing as a cause of staining. So not that you can't ever eat or drink these things, you just have to realize that if you do tend to consume any of these beverages or foods on a regular basis, that will definitely counteract the effects of tooth whitening a lot quicker. Our office is ready and excited to help you get your teeth as white and as bright as possible. Please call our office at 916-285-9678 or go to our website, www.crowndentistry.net, to schedule an appointment.